Hi, Bulls. Welcome to another episode of Reach Out for Help. I'm Alexia, and I'm a Peer Educator and the Center for Student Wellbeing. Today, I have Susanna and Austin with me to talk about the health services being offered on campus this semester.
Hi, Bulls. I'm Susanna. As Communication Officer, it's my job to make sure all of our students know about the services.
Hi there, Bulls. I'm Austin as the Operations Coordinator for the Medical Response Unit. I oversee, train, and assure quality assurance for the response program here at USF.
All right. Thank you so much for you guys coming today. So with this upcoming semester, some students may not know all the services that are being offered on campus to be able to keep themselves healthy. So Susanna, can you tell me about the services that Student Health Services will be providing this semester?
Happy to do so. So, we are actually providing all of the same services, but they look slightly different. General medical, sexual health and gynecology, athletic training, nutrition counseling, dermatology, psychiatry, testing for ADD, ADHD. We have our pharmacy in the Marshall Student Center. We've added COVID screening, and of course, Austin will talk more about our new medical response unit. That's super exciting. But we will have all of these services virtually by telehealth and video consultation, and also in person when needed by scheduled appointment.
Great. So kind of like what Susanna said, I know the medical response unit was launched last in the spring semester. So Austin, can you tell me a little bit more about that and also the services that you'll be providing on there?
Absolutely. So the Medical Response Unit is a quick response service that functions as a field extension of the Student Health Services Clinic. So our program, which is staffed by paramedics, EMTs, and first responders, will bring the services of the clinic to you if you are sick or hurt here at USF. Anytime that you have an injury or a sickness and you need help, you'd like to be seen at the clinic, you're too ill to get there, or you just like someone to come check on you, we are here to do that. And that is what we are here for all USF students.
I love that. So this is a question for both of you. What measures are being taken in response to COVID-19 to better protect both staff and students?
We do have a number of procedures that we've implemented within the clinic. So the first thing is primarily we are providing services virtually through video consultation or through telephone screenings. And what that allows us to do is limit the number of people physically in the building. And if you do have to come in person, it allows us to limit the amount of time that you spend in the building with other people, and therefore reduces your risk reduction. Reduces the risk of getting a virus or a sickness or really even COVID. In addition, we are separating sick visits from our well visits. So it is very important that our students call us in advance. I'm calling this call ahead med. Please do not try to walk in. We do need to talk to you about your symptoms beforehand so that we can schedule you accordingly. When we do have our sick visits and our COVID screenings, we do have the ability to sanitize the clinic. We can sanitize exam rooms. We can sanitize hallways. We have a special sanitizing machine, and we are doing a full cleaning every night in addition to the spot sanitizations whenever there is a student who has been ill or potentially could have COVID. The call ahead is going to be the most important part of that so that we can not only screen you in advance, but also schedule you accordingly. We're asking that our bulls do not bring their friends with them to the appointment. This is a change. In the past, we have had students come with their friends and emotional support and hold their hand and sit in the waiting room. That's not going to be possible in this new environment. Keep your friends safe, keep them at home. So you will have to come by yourself or they will have to drop you off. We will do a temperature screening and ask you some quick screening questions when you arrive. If you are doing the daily symptoms tracker on the app, that will actually give you a fast pass, campus pass for when you arrive. So if you do that campus symptoms tracker the morning of your appointment and then show us when you arrive for your in-person appointment, That will allow a fast pass for your check-in and screening procedures. And we are not using the waiting room. We're going directly to the exam room. So everything is kind of quickly done, and we're keeping you in the building as little as possible and around as around as few of people as possible.
Great. And for Austin, what are you guys doing on the MRU?
Yes. So the MRU is taking a number of steps to be able to protect both our responders as well as students, faculty, and staff here that we interact with on campus. Primarily amongst those is utilization of full PPE. So if we respond to you, we're going to be screening those callers over the telephone, which is how you're going to contact us. And our baseline PPE, we're going to be wearing always with gloves and masks. And if there is an instance in which somebody seems like they are sick, we will be wearing full face shields, N95s, gowns to protect both the students, who will be provided a mask as well, and our responders. In addition, after every single call, patient contact, we also have a sanitation machine. We will be sanitizing the vehicle and anything that we use on a patient after every single utilization and every single call.
Great. So, Susanna, what is the best way for students to make an appointment at Student Health Services?
The best way is actually to call us. So for both of our services, telephone is really, really important. Calling us allows us to talk to you at that moment, talk to you about your symptoms, set you up with either a video consultation or an in-person appointment, depending on what is needed in this situation, and to schedule you appropriately. We do have students who like to email us. That is not the best way to schedule an appointment. It means we have to go back and forth. We don't get enough information in the email about what you're feeling, what your symptoms are, and how long that has been happening, and we end up calling you anyway. So please just call us on the telephone. We're open Monday through Friday, 8 a.m. to 5 p.m. To schedule your visit.
Great. And for Austin, how can students be able to contact the MRU?
As Susanna stated, the primary method of communication for us is going to be the telephone. So that number 813-974-4678 or for the MRU is the way to contact us. We will be available for any student, faculty, or staff here at USF or guests of anyone here at USF from 10 a.m. to 6 p.m. Monday through Friday while the clinic is open.
Great. And for these services, are there any fees associated with them for Student Health Services?
It actually depends on the service. So yes, we use tuition to subsidize the medical care and to keep the student costs low, but there may be some fees. A general medical office visit, cough, cold, I don't feel well, is covered by tuition. COVID screening is also covered by tuition. The other services are specialty services that we offer at very low rates. So nutrition counseling and athletic training appointments are $10. Dermatology is $20. Psychiatry is $20 for the first visit and $10 for follow-up visits. Gynecology averages $30. And then we have our pharmacy, which also offers student rates, but that's based on the medication, many times even less than an insurance copayment. We can bill insurance to keep those costs low and further reduce your out-of-pocket costs. But if for a student who doesn't have insurance, insurance is not required or doesn't want to use their insurance because they don't want their family to know about their visit, we have those very low student rates, and that would be the maximum that you're being charged.
Great. And for Austin, are there any fees for students to be able to use the services in the MRU?
Luckily, no. The medical response unit is entirely free for anyone to use at any point. No matter if we just come to check on you and make sure you're all right, no matter what sort of supplies that we use, everything is entirely free. So no one should ever hesitate to call us. No matter what we do, whether you stay, whether we transport you to the clinic, everything is entirely free and will never cost anybody anything at any point. And another, sorry. Another point I'd like to add is anyone, as I said, is free to utilize the medical response unit service, but a disclaimer I always like to provide is that this is not a substitute for 911. So Anytime you are sick or hurt and you would like to go to be seen at the clinic, and you'd like to be treated by clinic staff, that is what we are here for. But everyone should know that in the event of a life-threatening emergency, you should always call 911.
Great, that's a good point for this. And we're going to end off on Susanna. Where can students go to get their prescriptions filled?
So we have a pharmacy in the Marshall Student Center, and a lot of students think that it's expensive because it's on campus, but we actually do a yearly review to make sure, and an audit actually, to make sure that we are within $1 of Walmart. So at the pharmacy, we not only have prescription medication, over-the-counter medication, things for allergy and sore throat and cough and cold, but we also have vitamins, personal toiletries, hygiene items, and you can even get, I picked up a knee brace there. So everything is very reasonably priced because tuition subsidizes it. And as a state agency, they have additional buying power. So that's our pharmacy in the Marshall Student Center.
That's great. And then that's all the questions I have for you all. So I want to thank you, Susanna and Austin, for joining me today to talk about the health services on campus. And I want to say to all of you watching, don't forget to reach to the Student Health Services and the MRU to get information on their website, as well as by calling them by their phone in situations that you need assistance and to get services. So I want you to be on the lookout for more Reach Out for Help videos from USF Wellness, and I want you guys all to have a great day. Go Bulls.
Go Bulls! Thanks for the opportunity, Alexia.
You're welcome. Thank you for being here. Bye. Have a great day.
Thank you. You too.